is Smita Kumar, and you're watching Medicircle. Today, on our healthcare startup series, we have Dr. Priyanka Mathur with us. Dr. Priyanka Mathur is a visionary who wants to take the sick care model to a data driven predictive model using the science of AI, that's artificial intelligence, and ML, that's machine learning. She began her studies at St. Petersburg State Medical Academy at the Symbiosis International University, where she received her MD in internal medicine and clinical research certificate. She has practiced medicine in 3 different countries: Russia, India, and the US. Last year, she started Medipocket to help individuals worldwide take care and take control of their health. Hello and welcome to Medicircle, Dr. Priyanka Mathur.
Thank you so much for having me.
So it's always been a pleasure talking to different startups, especially if there are women entrepreneurs running that particular startup. So it gives me immense happiness that we women are doing great in any part of the world. So beginning with this, Dr. Priyanka, like Medipocket helps individuals and their families take control over their health. So what offerings does Medipocket give to its consumers?
Sure. So, at Medipocket, we believe that you can have a control of something when you're involved and informed about it. So at Medipocket, we empower our patients, our consumers, to be involved and informed about their healthcare needs, to be a better advocate for their family and their family healthcare needs. So for that, we provide an accessible, affordable, and a transparent cross-border care ecosystem. So where the patients can easily access, without any border restriction, without any travel, the best specialist care in United States. It looks very simple on the surface, but it has a science of AI to it, where we keep the patient's security and privacy at its heart.
That's very important also. So what is Medipocket's USP over other similar ventures that offer complete healthcare ecosystems?
I would say two. The number one, that Medipocket is not restricted by borders. We are a cross-border care ecosystem where specialized and personalized care travel to the patient across borders, and the patient can access the best specialist, again, borderless. And number two, which I would say the most important, is that the healthcare solution is not designed by just engineers or medical outsiders, but it is first and designed by healthcare professionals that have international care system experience. Like myself, I'm a trained physician with a healthcare system experience of 3 different countries: India, Russia, and United States. So the solution is not based on assumptions, but is based on the first-hand experience of the patient's need and system requirements.
So that's much needed. I think something, a system which is especially in the medical, and if it is designed and analyzed and contributed by medical professionals, definitely it adds an edge over it. So Medipocket primarily works in the US. So are there any other plans to expand in India or some other territories?
So Medipocket was started in California, US, and we started with the prescription vertical to provide transparency, affordability, and accessibility in the medications. For that, our users comes to our platform to compare the pricing of prescription medications through our partnered pharmacies, and we are integrated with the live API, so we give them the live pricing. And from there, they can afford by using our Medipocket discount card at 70,000 partnered pharmacies in United States. Medipocket cross-border care is a global venture where the international patients outside United States can access the best hospitals and US specialists through our platform with just few clicks from their country. And we are coming to India. We are launching in India because, first of all, that's my home country. I have worked in the system. I understand the need, how struggling it is sometimes for the patients and caregiver to access the best specialists. And US seems sometimes to be very far, but with technology, we are bridging that gap. So you can access the best quality specialty care just with few clicks through our platform.
That's good to know that you will be like expanding Medipocket, especially in your own hometown. But definitely there would be different kinds of challenges. As per different geographies, there would be different challenges. But let me ask you one thing here. So you will be only expanding in the planned medical treatment cases and not for any other thing, like no emergencies and other things.
It won't be emergencies, because I think emergencies does require the urgent physical care. In our cases, they will be more like on a chronic or a rare conditions where you do need a specialized opinion sometimes, or even a specialized in-person treatment. So that is where Medipocket comes in, where we can help with that, with the cross-border specialty care.
Sure. So, Dr. Priyanka, your venture has received a pre-seed funds in 2019. So, are you planning to go for any funding round in 2022?
Sure. So Medipocket RX, which is a US venture, got a pre-seed funding to build the platform. And since then, we are able to self-sustain the growth. Medipocket Global Venture, which is a cross-border care, is looking for a seed funding, as we are aiming to have our growth in year one. We are aiming to achieve 200,000 users with 30,000 consultations. And with right funding and right partners, that will be very well attainable.
So how much fund you are planning to raise?
So to expand at more border or territories in India, I would say we are looking for initially 1 to 1.5 million of a seed funding.
Okay. So as you just answered this question, like how many patients Medipocket have so far impacted? So I think it's like 30,000 you said.
So Medipocket so far, the RX has served 80,000 plus customers in US for our discount card. For that, as we have partnered with the major pharmacies like CVS, Walgreens, Rite Aid, and others in US. Medipocket cross-border care, which we are launching in India, is targeting to have a 30,000 consultations, US consultations, and 200,000 users. Now, just to differentiate why the users and consultation is different, is Medipocket platform is not only providing the consultation cross-border, but we aim to have our patients involved and informed about their care. And for that, we have Dr. AI, which is their personal assistant. I call it an intelligent personal assistant that help them to navigate through their symptoms, match them to the right specialization, and from there they get connected to the best US specialists or hospitals.
Okay. So, but to provide such huge, bandwidth of services, you need to have a very good network of doctors and pharmaceutical companies. So, what is the present strength in that segment?
So for the RX prescription, which is a US vertical, we are partnered with the pharmacies for the affordability and transparency part of it. In India, for the cross-border care, in US, we have partnered with renowned hospitals like UCLA, USC, Cedars, Mayo Clinic, and others. On our platform, we have, I would say, the best US super specialists on our platform for patients to access. In India, we are partnering with hospitals, insurance companies, and diagnostic centers for their members and patients to provide me a Medipocket as a premium US service where they can access, again, the US specialist, just few clicks, or get a treatment at US hospital as needed.
Okay. And what were your revenues in financial year FY21, and what are you planning to close at the end of FY 2022?
So for 21, our prescription model or a prescription discount card shows got a very, very high growth because pandemic made affordability a main concern for most of us. So we have seen in numbers, I would say we have seen a 150x growth in 21 for our discount card. For 2022, our all focus is on cross-border care, the global venture. And for that, we are aiming at the numbers of 200,000 users and 30,000 consultations in year one.
Okay, that's good. And what primarily are the goals of Medipocket that you want to achieve in 2022?
So in India, we actually opened earlier this month, we opened the pre-signups, and we saw a very, I would say, overwhelming response from the patients and caregivers who want to use our solution. So we are currently taking requests for the consultation with the US specialists in the areas like cancer, cardiology, diabetes, neurology, infertility, mental well-being, plastic surgery, and a special LGBTQ health. These areas are super specialized, but at the same time, as we know, some of these areas are very private, where people find it really difficult to open up still. So through our platform, we want to provide that privacy and a kind of a feeling of privacy, I would say, and a security through our platform where they can access these specialists and talk about these concerns. So that is our primary focus, to bring the super specialty, but we won't be restricted with this. when down the line, we will be opening up more and more specialties and access to more and more care to US, but that is a primary focus, I would say, in our phase 1.
So, but one last quick question, Dr. Priyanka, like as the way the healthcare is being delivered and accessed in the US, it's completely different because there is a lot of government saying and taking there, because there are a lot of things like after 60 years of age, you get free healthcare and stuff like that. Whereas in India, there is a lot of privatization yet, and people don't trust that much government hospitals. So, what would be the difference of in approach, or especially while you would be, trying to brand this Medipocket here in India?
That's a very good, definitely the systems are very different here. I always say the West has some best part to it, so we can bring the best of the West to our country, and that is the structure. And the structure of I would say the healthcare structure in United States is very, very well defined. And I think that's what we need in in India to bring. So that is what we are bringing. As far as the care access and affordability, in US also, we are moving a lot to a value-based care now. Before it was all like, as a sick care model, but
Yeah.
now people are moving to a value-based care in all, I would say, age group. So value-based care is becoming very, very prevalent in United States. And the same in India. I think the affordability and accessibility with technology we can bring to more and more people in India. It would require education. It would require some awareness, I would say, in majority part of the country, but that is what I would say we have taken our mission to educate people that, as you just said in the starting, we should not just approach healthcare when you're sick, but you need to approach it when you're not sick so that you don't get sick.
Definitely.
So that is where the technology and I say the Medipocket would come in.
Sure. So it was really great talking to you, Dr. Priyanka Mathur, and thank you so much for joining us today on our healthcare startup series. And we wish you all the best with Medipocket. Just one quick message from you for all the fellow women entrepreneurs, especially, and especially for those entrepreneurs who are trying to pitch in their solutions to cross-border territories. So, do you have any message for all such people?
I would say just get out of your comfort zone. I would just do it. Don't worry about how it will turn out, who will say, doesn't matter. Just do it. And I think I learned from my journey that when I came out of my comfort, when you are a doctor, you have a kind of a very comfortable cushion around you, right? You're making a decent one and you don't have to worry about anything. It's like, what your paychecks would be at the end of the month. Coming into an entrepreneurship is a completely uncertain kind of a scenario. You just don't know what tomorrow would be bringing to you. And obviously all the time it's a problem. But yes, so I learned is just do it. And then you will be finding ways. Only one thing I would say, don't think that you will be ready to solve every problem.
Yes.
Every day will have a unique problem. Just wake up every morning. It's like, okay, throw me more problems. You have to figure it out. So yes, that would be my thing, that please take your first step. Don't hold yourself in a comfort zone.
So thank you so much for this cool and great advice for all those who are watching this video today at Medicircle, because at least definitely we need to come out of our comfort zones and at least try to solve one or two problems a day. Definitely we are not able to solve everything, and definitely, but yes, there should be a baby step process, then definitely you'll be able to reach your goals someday. Thank you once again for joining, Dr. Priyanka.
Thank you so much. It was my pleasure.
Same here. Thanks.